How can I stop heavy menstrual bleeding from adenomyosis? Heavy menstrual bleeding caused by adenomyosis can be quite challenging, but there are several evidence-based options to help manage it effectively. The first step often involves medications that reduce bleeding and relieving pain. Non-steroidal anti-inflammatory drugs, such as ibuprofen, are commonly used because they work by lowering prostaglandin levels, which are involved in uterine contractions and inflammation. Taking these medications starting a day or two before your period and continuing through it can help lessen both bleeding and cramps. Hormonal treatments are another mainstay in managing heavy bleeding from adenomyosis. Combined hormonal contraceptives like birth control pills, patches, or vaginal rings can regulate your menstrual cycle and often reduce the amount of bleeding by thinning the uterine lining. For women who prefer a more localized approach, progestin-only options such as the levonorgestrel-releasing intrauterine device are highly effective. This device delivers hormones directly to the uterus, causing the lining to become thinner, which significantly decreases bleeding and pain. It is especially useful if you want to preserve fertility or avoid surgery. In some cases, doctors might suggest gonadotropin-releasing hormone agonists or antagonists. These medications temporarily induce a menopausal state, which reduces bleeding and shrinks the uterus. However, because of their side effects, like hot flashes and bone loss, they are usually used for short periods and under close medical supervision. If medications do not adequately control symptoms, minimally invasive procedures might be considered. Endometrial ablation destroys the uterine lining to reduce bleeding but is generally not recommended if you want to keep your fertility, as it often prevents future pregnancies. Uterine artery embolization is another option that cuts off blood flow to the affected areas, reducing bleeding and pain. But keep in mind, this procedure can impact fertility, so it's usually reserved for women who do not plan to have children. For severe cases that do not respond to other treatments and significantly affect your quality of life, hysterectomy, or removal of the uterus is the most definitive solution. It completely stops menstrual bleeding and removes adenomyosis symptoms but also ends fertility. This option is typically considered only after thorough discussion with your healthcare provider. In addition to medical treatments, simple self-care measures like applying heat to your lower abdomen or taking warm baths can help ease pain. Since adenomyosis symptoms often improve after menopause due to hormonal changes, your age and reproductive plans are important factors in choosing the best treatment approach. Overall, managing heavy menstrual bleeding from adenomyosis involves a combination of medications, procedural options, and lifestyle adjustments tailored to your individual needs and goals. Consulting with a healthcare professional who specializes in fertility and endometriosis can help you develop a personalized plan that balances symptom relief with your reproductive wishes. Remember, every woman's experience is unique, and what works for one person might not be the best for another, so professional guidance is key.